Up first, a story not to be missed.
When our neighbors in need are facing a medical crisis, We Care Jacksonville makes sure they do not have to face it alone.
We Care Jacksonville was born out of the minds of some local community doctors who were a part of the medical society, who looked around and knew that there was a gap in care and access. They wanted to make sure that those patients who were uninsured or impoverished also had access. And because of that, they established We Care, which provides specialty services for things like cancer and diabetes and surgeries that were needed. Healthcare isn't something that is just a privilege of those who can afford it. You don't have to think about how this is going to be a financial burden. We're here to ease that burden.
The primary mission is to provide specialty healthcare and services at no cost to those most in need.
100% of our patients fall below the 200% poverty level, and then greater than 50% of those fall even below 100% of the poverty level. We serve as an umbrella organization for our local free primary care clinics, and it allows us an opportunity to provide specialty care for those who have gone through those free clinics and are now in need of higher level services. If someone needs a colonoscopy or if someone needs their mammograms, we make sure that these services are available. But if someone needs emergency surgery, we have volunteers who will provide that service to those patients at no cost.
Meeting the need of the community and connecting patients with compassionate care is We Care Jacksonville's primary goal.
I have cancer. Unfortunately, it is what it is, a serious problem when it comes to financial things. I went to treatment and I paid for it, but then I ran out of money. And then what do? And We Care stepped in and gave me all the necessary help to see a doctor that specialized for my type of cancer, which was bone marrow cancer. They got me connected with medical facilities that could stabilize my cancer, making my life better and livable again.
I approve the authorizations for the oncology patients to get treatment. We help get them food delivered to their houses. We can reach out to the community to help get them the resources that they need.
As the hub of a wide variety of services, the potential to help others is great and growth is welcome.
We've grown the number of volunteers in our community to over 500 today. Last year, those volunteers and the partners they work with donated over $20 million of health care to our uninsured neighbors right here in the community. For every dollar that was donated last year, we were able to return $26.58 of medical care to our neighbors, and that's an incredible return on investment. We are seeing greater need for patients with things like housing and nutrition, transportation to appointments, support making sure they can complete the care plan that their doctors and providers are offering them. We've grown to include things like RN case managers who help patients get through the complicated treatments they have to make sure that we're really leveraging all of that amazing donation of support the patient's getting. Our new facility is truly a great achievement so that we're able to see more patients, we're able to have more space to bring in our provider volunteers, and we're also now within a nonprofit hub with other nonprofits who also serve our clients. That collaboration right under the same roof was the brainchild of Lutheran Social Services. We are thrilled to now be on their campus and being able to coordinate care for so many more people.
WeCareJax remains committed to matching patients in need with caring volunteer providers.
I got involved with WeCare after I retired because I felt like I still had something to give back to the community, and it's a great experience both for me and for the patients. The patients are pleased, they know they're getting quality care, and it's a very good program that's needed in this community.
So for the patients out there who feel that they have nowhere to go for health care, who feel that they don't have access, that's what we're here to provide. We're here to make sure that you get what you need when you need it. You don't have to delay health care. You don't have to delay getting yourself taken care of. Call WeCare. That's what we're here for, because we truly do care.
I would recommend that people, even though it seems to be hopeless to find help, like it was in my case, I was helped by WeCare. And I greatly appreciate that they were there for me at any time.
If you or someone you know is looking for equitable access to quality health care, visit WeCareJacksonville.org or just go to our website, thebalancingAct.com.